So, Mr. Albrecht, we are here at the Cancon meeting in Rome, and the first question would be if you could be so kind to introduce Cancon shortly and describe how it aims to contribute to reducing the cancer burden in the European Union.
Yes, the project called Cancon, or Cancer Control, is a joint action, which means that it is a project of joint policy development between the European Commission and the member states of the European Union. It is co-financed by CEFEA, the Agency for Public Health Projects of the European Union, which means that about half of the project, in this case exactly half of the project's costs, are covered by this grant, and the rest is financed by the member states, the interested governments of the member states. This also explains the approach of the project. It means that it aims at jointly developing both the issues and their solutions for the policy challenges in particular area. In this case, the topic is obviously cancer control.
As the names, as far as I know, of Cancon's outcome document is as titled as European Guide on Quality Improvement in Comprehensive Cancer Control. Could you just give us a short idea of what the aim of this document is and how it will help policymakers and governments and cancer care professionals to improve their work?
Yes. In the development of the project, 4 key topics had been identified. They are networking of cancer care institutions into creation of comprehensive care networks or cancer control networks in Europe. The second topic was community cancer care, then made more precise as cancer aftercare for patients, then the topic of survivorship, and finally the issue of screening. So if I start from screening, the project aims at informing policymakers about new knowledge, new findings, and give what we call guidance, which means they are not guidelines, but they are guidance for policymakers on how to structure their decisions with respect to screening for 6 different organ sites. In our case, these are the 3 that are covered by European guidelines, which means cervix, breast, and colorectum. And then there are 3 cancer sites that have raised a lot of interest over the last years. One concretely, the issue of prostate cancer over several decades already. So this is one of the topics and one of the chapters in the guide that you have just mentioned. The second topic is, as mentioned, the aftercare, the period, as it had been mentioned in the conference also. Aftercare is a period that had not been structured well, because in the past, as the senator from Italy mentioned, we were happy that the patients survived, and that was it. We just said to them, basically rest and be happy that you survived. We know that today, with the increasing survival, we have new challenges, additional issues arising from employment, social challenges, also monitoring of these patients. And this leads me to links between the 2 work packages and chapters, one on aftercare, which is focusing in our work mostly on guidelines on how to follow up patients, how to address these challenges from the organizational point of view. And then we have the topic of survivorship, which covers patient experience and patient survivors' challenges that they are facing. In France, they formulated the so-called droit d'oubli, which is an answer to the pressures that cancer survivors were facing in their normal life situations, like taking out mortgages, loans, and so on, when banks confronted them that they were very risky loan takers. Finally, we want to wrap these 4 topics up in this guide and we will accompany them, these chapters, these topics, with common recommendations and conclusions, which will then be forwarded to the policymakers. So this is the main outcome. This is, of course, one of the two pillars, as mentioned also by Mr. Schreck earlier today, and the other pillar are the so-called policy papers. They are intended to inform directly the policymakers on 5 topics that are not directly covered by these 4 areas, and they have been chosen in a very democratic way. We have asked member states to vote what are the topics that they feel require a special formulation in the form of a policy paper. And so we arrived to these 5 topics: national cancer plans, social inequalities and cancer, disinvestment, effectiveness of cancer prevention, and public health genomics.
Okay, thank you very much. So, as we working together with many other partners from all over the world in the International Cancer Control Partnership, so-called ICCP, which aims to support cancer planners and decision makers at every level. So, and the long-term goal is that all countries have and are implementing a quality cancer control plan. So, could you just tell us a bit more about the current situation in the European Union?
As you know, there was convergence in these initiatives on your side, I mean on the side of UICC and European Union. And although maybe a few decades ago many perceived the cancer plans as being instruments, because WHO was also working in that direction, mostly for low and middle income countries, EU raised it to the highest level of coming up with a recommendation that the member states would actually formulate and adopt cancer plans. This was helped also by the initiatives taken first by Denmark, France, UK, who were the front runners among the high income countries. And I have to say that this recommendation resulted in the vast majority of member states actually responding to this challenge and to this invitation and actually formulating the cancer plans. We currently have only 2 member states that never had a cancer plan formulated as we expected it to be. They are Bulgaria and Slovakia. They are both working on some sort of formulation of this plan. And Netherlands, for some reasons of their national interest, decided not to proceed with a new cancer plan. All the other member states actually have some sort of a cancer plan, and now we are looking more into its structure, because as you probably know, sometimes they are just a list of priorities, sometimes they are action-oriented of what they want to develop, but they don't pay too much attention to what services exist or how they could be improved. Sometimes they are a vehicle to introducing new programs, such as research or screening and so on, but we want more. We followed on the guidance that was given by WHO earlier, and we developed under the previous joint action the so-called European Guide for High-Quality National Cancer Control Programs, and now we will try to compare what the member states did and those who adopted new cancer control programs, if they followed our guide or if they chose another way. We even have a practical example. Romania actually followed the guide, and we were very happy when we met in Bucharest in April, a high-level event introducing the National Cancer Control Program. It helps that the Minister of Health is an oncological surgeon, but it was nice to see that they followed all the chapters, including patient involvement, survivorship, rehabilitation, not to mention, of course, prevention and integrated care.
Yeah. Well, referring to what you said, as now most of the countries in the EU have a national cancer plan, what do you think? Is then the implementation the next big challenge to enhance cancer control in Europe, or are there others?
Implementation is certainly one of the challenges. Setting up clear goals is I think also a challenge for some countries. And it's true that not all countries can afford such a structured system of indicators as, for example, France introduced, which has every 3 months the obligation of all the actors in cancer to report on 55 indicators, which of course is quite a massive system that I'm sure that many countries cannot develop. And of course we are facing another challenge. France is a little bit at ease in developing such structures. We know that many, or even I would say most of the European member states are now decentralized. All the federal countries, including of course not only Germany and Austria, also UK, if I add them to this story, which is completely decentralized now, including the country where we are at the moment, Italy, and Spain, which has a national cancer strategy, but the actual cancer plans are then implemented by autonomous regions. This is, of course, a huge implementation challenge. And the next challenge, in addition to your question, is, of course, the challenge of including all the aspects that need to follow. We heard today a lot about rehabilitation, which I think is an important challenge, especially for younger cancer survivors, but also for older. They shouldn't just go back home and, arrest, as some people would say many years ago. And psycho-oncological support, psychosocial support are very important issues because cancer represents still a major burden on the individual patient, on the partner, spouse, or carer, and on the family as a whole, because these uncertainties related to cancer are really something that I think many societies are underestimating.
Okay, cool. Thank you very much.
You're welcome.